So I'll tell a little about Denmark, cancer in Denmark, what it means, and what ESMO can do to help us, and maybe also the role Denmark can have in ESMO. Before this ESMO meeting, we joined in a partnership with all the important stakeholders in cancer treatment in Denmark. We teamed up in order to present how we treat cancer in Denmark, and the motto from cancer treatment to patient care fits very well in the Danish model. Yesterday, actually, we had a presentation of the Danish model in a closed meeting with 100 delegates, where we presented the program, and I will give you some of the highlights of this event. The partnership is comprised of both the media bureau that helps ESMO preparing the media releases, the Hansen Agenda, then the Danish Society of Clinical Oncology, and I'm president of this society. Then it's the national, the health authority in Denmark, and then it's the regions that are running all the hospitals in Denmark, and then there's the Danish Cancer Society, who represents the patient advocacy groups. Other partners that are very important in the field are also the young oncologists, and they are the future doctors, and it's very important to have their inputs. And of course, there's a big team here in Copenhagen also to have the whole team for this meeting. Wonderful Copenhagen Rigshospitalet and Copenhagen Science City. What does the partnership mean? Some of the issues that has been implemented in Denmark for cancer treatment is establishment of cancer pathways. Actually, it was decided that cancer should be looked upon as an acute disease. So if a patient had a symptom or definite signs of cancer, then they should be referred for investigations immediately without any delay. And we have national quality programs because in Denmark we have a unique personal identification number for every citizen, so we can follow the path of each citizen when they go to hospitals, when they get a diagnosis, what treatment they get, and we can make also epidemiological studies. So with this tool, we can actually follow the patient and make sure that the waiting time between diagnosis, referring to treatment, getting the treatment, the rehabilitation, and also supportive care is being given within the time limits that is part of the legislation. It's also been focused on personalized medicine and national cancer biobanks. Actually, that is something that is public funded, and I think it's quite unique. Clinical trials and research is very important also in daily practice of cancer. And we try to create an infrastructure so clinical studies can be taken care in all cancer departments and offered to the patients every day. And in Denmark, we have established clinical trial offices, sort of one-stop shop for industry and other partners in order to identify sites to perform clinical trials and also investigators. And recently there was an increased focus on also early cancer trials, phase 1 and proof of concept studies, and there was established a national experimental therapy partnerships that actually means that we have a database of all clinical studies, and all patients in the country can be referred for the sites where studies are open. So this really can increase the number of patients being offered clinical trials. And we try to make a brickless Danish comprehensive cancer center in order to improve the infrastructure, both for basic research with the collaboration with academia and the university, clinical research and epidemiological research, and also in collaboration with industry. The statistics in Denmark are, in some cases, very good. Actually, in March this year, United Nations once again ranked Denmark as the happiest country in the world. That was actually the third time. So how come we are a country with high taxes and long winters? So how can we explain? Well, maybe because we have a free public-based healthcare system with equal access to healthcare for every citizen. However, it's not only positive. In a recent publication in Lancet, there was an evaluation of sustainable development goals in 188 countries, and Denmark was ranked number 16 and below most of our neighboring countries. And of course, we don't like that. And our cancer statistics, they are not the best. It was mentioned before that cancer death is the most frequent cause of death, and actually Denmark is second in Europe with this number. And this slide maybe is a little busy, but you can see when we compare with our neighboring countries, Finland, Iceland, Norway, and Sweden, this is lung cancer statistics, we have the highest death rate and is way above the mean. However, the cancer plans really have improved outcome. This has been organizational changes, but of course also access to the newest medicine. And you can see from these slides that we are catching up with the neighbors, and we hope that we will maybe take over in near future. So the national cancer plans the first one came in 2001, and it introduced healthcare law of the patient rights for the waiting times I mentioned before in the cancer packages. We established a multidisciplinary cancer groups for every cancer type, where a team of specialists, both surgeons, oncologists, radiologists, and pathologists team up to make the optimal guidelines and make sure that every patient's case is reviewed by experts to make the right plan. And we have a national consensus of the rapid diagnosis that I mentioned before. This is also part of the cancer plans. We had structural reforms in order to make sure that, for instance, cancer surgery is not taking place in all departments, but in very few departments, because this increases the competences, and we can really see that it increases the survival. And in 2007, we have a new legislation on smoking in public places. So this was some good thing among some of our lifestyle problems in Denmark. And the new cancer plan that was recently launched is actually being debated in the parliament today. And some of the main goals is that we will have survival rates comparable with our neighbors, that in 2030 we will have the first smoke-free generation. So children born today, they should never start smoking. And we also aim that 90% of all patients by 2020 will have a single doctor being responsible for their continuity of care. Finally, about research in Denmark, we have a very good record. The output is high. Only Switzerland and Iceland produce more scientific papers per capita than Denmark. We also have high impact. We are ranked number 4 in the world in scientific publications per capita. So we are very proud of that.